A spike in childhood obesity and diabetes has caused new concerns about how the pandemic could be making what's already an extreme health risk for communities of color worse. A recent CDC report found that children and teens have gained weight during the pandemic at an incredible rate. Body mass indexes have doubled between 2018 and 2020 for children aged 2 to 19. Because a rise in body mass index can often be a warning sign for diabetes, some are now concerned about what it could mean for the communities of color. When the Journal of American Medical Association studied diabetes in children between 2001 and 2017, they found a whopping 95% spike in type 2 cases. The group with the fastest growth rate in those cases were Black and Hispanic children. So are we headed in a troubling direction, and what can we do about it? Joining me now to discuss is Pediatrician Dr. Marilyn Corder. Dr. Corder, I was just shocked by these numbers. I couldn't wrap my head around it, and I when I thought about it a little bit, it made sense. I guess that there were so many children who were home and couldn't, go to recess, and so many children who were home and not being able to eat a school lunch or school breakfast, and maybe that was part of it. But can you help us to understand what is happening here?
Absolutely. And again, thank you for having me. So I've been a pediatrician now for 40 years. That's 4 decades. And over the past 2 decades, we have seen a rise in childhood obesity, especially in children of Black and brown. But this pandemic, oh my goodness, it's a lifestyle change to lose weight, to get into the entire family dynamics. Well, when the pandemic came, it was collateral damage because it was like childhood obesity eclipsed with the pandemic. So all the children were doing was they were at home, they were shut down, and they were eating. Their activity was sofa to the kitchen, and the kitchen to back to the sofa. And this was the exercise. And we're seeing so much. Ordinarily, children would gain 5 pounds a year, and those would be the average size. And then the larger children, maybe 8 pounds a year, and then the obese, maybe 10. But we're seeing 20 and 30 pound weight gain in 1 year. And this is tragic. I, as a pediatrician, talked about, I see young people, they're healthy, et cetera. I'm seeing adult conditions. I'm seeing diabetes. I'm seeing hypertension. I'm seeing COPD, sleep apnea, joint pains, things that come along with being chronically obese. And it's only getting worse. So we have got to change the diets. We have got to really put the money in now. Otherwise, we're talking years later of chronicity, hospitalization, disability, and the like.
Well, can this be turned around? Can we just, send the kids back to school, they go back to recess, they go back to eating the in-school meals, and it turns around? Or are this condition, the conditions that you just described, the illnesses you just described, are those things that are going to stick with those children even if they go back to a more active lifestyle, even if they lose some weight?
Well, it can be turned around. Let me just say that's very possible. However, it's going to take everybody. It's going to take the entire village. It's going to take the pediatricians. It's going to take the school nurses. It's going to take the teachers. It's definitely going to take the family members, including grandma, and mommy and daddy all have to be on board. And I know we have a program here in the DMV called Quarter Pounders, and we had to go into the homes. We had to make sure they signed an agreement. This is what is good for your child. You must do this so that when he or she is craving pizza, he's not eating 5 slices of pizza. So we have to also make sure that child, as they deal with anxiety and stress, because that's what we're dealing with. And often we're eating for comfort, not really for hunger. And we have to change that dynamic around as well.
Let's talk a little bit about that family dynamic, because I think that, part of the parental instinct in us made us try to make the kids happier by making treats and making food, and everybody's Instagram was full of, I've learned how to make bread and I've learned how to cook this special thing. And so people were just cooking as a way of having community and family activity, and they were eating as a way to be, if we're gonna be stuck inside, at least we're gonna have, food and we're gonna enjoy ourselves. And the impulse is good, it's just that the effect appears to be horrible.
So you can eat and do the cooking and have the activity, but it's what you're preparing. So if we're talking about a veggie meal, we're talking about, the water, the different things, the apple slices, making it fun. But we shouldn't be talking about macaroni and cheese and all the fat things that, the pork, the different things that culturally we tend to eat more of. Unfortunately, it has come back to bite us and it's worse. And with that, we're seeing again fatty liver, problems with breathing. So it's possible, but we all have to be in this. It has to be a total dedication.
Right.
Going back to sports, going back to eating
Right.
better, living better, and really making it a commitment.
So we're about to go into a big family holiday, Thanksgiving, one of the first ones some people have had since the pandemic started. There'll be tons of food around. What conversation, I have like about 30 minutes left, 30 seconds left here. What conversation do you want those families to be having over all that food?
It's not the last meal. Please note that. And you want to make sure that you understand that drink your water, a glass before you sit down to that big meal, and then exercise, walk, do a few things right there so you can kick it off. I'm having weight checks for my patients. I have 250 pounders, 300 pounders, and I'm like, look, I know Thanksgiving is coming, but let's be real, because I have to see you a week after Thanksgiving, and let's make it a real commitment.
Folks, it's not the Last Supper. Dr. Marilyn Corder, thank you so much for joining me tonight. I really appreciate your time.